Alright, so today we are going to go over some of the musculature of the trunk. Looking at this figure, some of the muscles you can see. Again, here's your sternocleidomastoid on that sternum and clavicle going up to the mastoid process. Here you can see the trapezius wrapping over the pectoralis minor on some of these ribs. Here you can see the serratus anterior, latissimus dorsi, some of the intercostal muscles. The muscles of the stomach, your external oblique, internal oblique, transverse abdominis, the rectus abdominis. Here again you can see that serratus anterior, your biceps brachii, pectoralis major, the deltoid up here. So the first one we're going to talk about is going to be the trapezius. So if you look at the back, this is a very superficial muscle that you find on the back, and it has three directions that it goes. And so if you look here, you can see how these fibers run up the neck. They also run across and down. So it has origins up here on the occipital and throughout the thoracic spine, and then it inserts over here on the scapula. So whenever you contract these muscles, you're going to move the scapula either up or towards the middle, maybe down. And so if you do like shoulder shrugs, you're strengthening your trapezius. Next one is the deltoid. This is that big shoulder muscle. It looks like a triangle. Remember when we were naming this muscle, we named it because it looks like the delta, the triangle in the Greek alphabet. It inserts down here on the humerus, on this deltoid tuberosity. And so this is the insertion. The origin is up here on the clavicle and scapula. And so when you raise your arm, you are using your deltoid. So when you're doing abduction, you are raising this bone away from the body. You're using your deltoid here. Then we have our pectoralis major. This is that really big chest muscle that is anterior. Pectus means breast, and so pectoralis major is the big breast muscle. Its action is it's really good at flexion and adduction, so bringing that arm towards your body is an example of adduction and using your pectoralis major. It's also important in the rotation of the humerus, so internal rotation, and so taking that humerus and rotating it towards the body. It has origins over here on the sternum, and then it inserts over here on the humerus. So it can bring that humerus closer to the body. Moving down, we're dorsal again. And here you can see the latissimus dorsi. Some people shorten this and call them your lats. So you have your lats. And I guess I should have told you that sometimes people shorten the trapezius muscle to call it your traps. Your traps and your lats. But on tests and exams and stuff, quizzes, make sure to write out the entire name, latissimus dorsi. Just don't call it the lats, because that will be counted wrong. It has origins also on the spine, around the thoracic and lumbar, and then it inserts way up here on the humerus. And so, if it's inserting up here, when it contracts, what is it going to do with that humerus? It's going to bring it down. And so, your latissimus dorsi is really important in adduction, so bringing that humerus down towards the body, just like the pectoralis major. Then we have our serratus anterior. Serratus looking like it is serrated, like a knife edge, right? You can see how it's kind of jagged. You find your serratus anterior on your ribs 1 through 8, and so mostly found on your true ribs. Inserts back here on the scapula, And so when it contracts, it's going to bring the scapula forward, moving it anterior, and it also helps to lift the ribs up. They sometimes call this the boxer's muscle. If you look right here, Manny, you can see them right here. So they're really important in bringing that scapula forward, which helps to project out the arm. And so sometimes they call this the boxer muscle because it helps you when you throw a punch. And then we get down to your external obliques right here. Oblique because it runs at a 45-degree angle. It looks kind of like a V as it comes down. It'll come down on this other side. Your external oblique pulls the chest inferior, so brings it down, and is important in ipsilateral bending. Ipsilateral means same side. And so if you bend over to the left, you're using your left oblique to contract that area, and so you bend over there. But it's also important in contralateral rotation. So if you want to rotate the other direction, so if you want to twist to your right, you will be using your left oblique. That's kind of confusing, but that's how it's used. Then we get to your rectus abdominis. Has the origin up here, or the insertion up here on the xiphoid process, the origin down here on the pubis. So when you contract this muscle, it bends the body forward. So it's very important in flexing the trunk here. So trunk flexion, bending forward, doing like a crunch, which is good if you need to breathe out really hard. What are you going to do? You're going to bend over and breathe out. It's also important in defecation. It helps you push out the stuff that is inside your intestines, and also in childbirth, so parturition. So your rectus abdominis. Here you can see the linea alba, the white line that runs down the middle, and those tendinous intersections that can give you a six-pack. So those are the superficial trunk muscles, so the ones that are closer to the surface. But we also have deep trunk muscles, like your pectoralis minor here. You can see it attaching to the ribs, and it inserts back here on the scapula. And what it does is it helps to draw or move that scapula superior, so to lift it up, with the inferior edge posterior. And so it kind of lifts it up and pushes back that inferior edge. Sometimes they call this winging, when you can flip out the scapula like that. You're going to be using your pectoralis minor to wing. Then you get down to your internal oblique. So if you remember, the external oblique kind of look like a V coming down. Well, the internal oblique is running at a different direction. It kind of runs up towards the middle. And so it kind of looks like an A or an inverted V going like this. So your internal oblique is going to be important in ipsilateral rotation and side bending. So if you remember, for the external it was contralateral. For the internal it's going to be ipsilateral, so same side rotation. And then we have our transverse abdominis. This one runs side to side. And it's also the deepest of your abdominal muscles. So you have your external oblique, your internal oblique, and then your transverse abdominis here. And its job is to compress the ribs and the viscera. Sometimes they call this the corset muscle, where you can tighten that up. If you've ever seen those diet or workout commercials where the person is like pushing out their stomach, and then like, in just 5 minutes a day you can whatever, and then the next picture you see them with the nice like tight abs. Normally it is this muscle, this transverse abdominis, that they're pushing everything in with, the corset muscle. And those are your deep anterior, your deep anterior trunk muscles. Moving to the back, again, trapezius, deltoid, your erector spinae, your latissimus dorsi. You can still see the serratus anterior back here. Teres major, minor, infraspinatus, because it's below the scapular spine. Supraspinatus, because it's above the scapular spine. And then also underneath the trapezius, you have the rhomboides, major and minor. I just want you to know these as the rhomboid muscles. Then you have your levator scapulae, and then your splenius capitis. So the splenius capitis has origins on the cervical vertebrae, so it starts out here on the neck, and then it inserts up here on the occipital bone, and it is important in shaking your head. So when you contract this, it's going to pull this side of the head closer to here. Bring that side of the head closer to there. And so it allows you to shake your head. Getting down to your rhomboids, it has origins up here on the thoracic vertebrae, inserts on the medial edge of the scapula, and it allows you to adduct the scapula, or to bring your shoulders back. It also can pull on this vertebral column. Moving down to the supraspinatus, supra because it is above that scapular spine. It inserts over here onto the head of the humerus, or onto the greater tubercle over the head of the humerus, my bad. And it allows you to abduct your arm, so to pull it away from the body. This is one of your 4 major rotator cuff muscles, your supraspinatus, reaching over the top. Then you have your infraspinatus, the one below the scapular spine, or inferior of the scapular spine. This is also one of your 4 rotator cuff muscles. It again is found on the scapular spine below it, and inserts also on the greater tubercle. It allows for external rotation of the arm. So when you take your forearm and put it against your stomach and then rotate that out, that is using the infraspinatus to do that external rotation, so to bring this arm back. Your levator scapulae tells you exactly what it does. It levitates the scapula, right? So it brings the scapula up. So the insertion is going to be down here on the scapula because that is the bone that is moving. The origin is up here on your cervical vertebrae. Then you get to your teres major. Teres major, you see it right here on the inferior portion of the scapula. It inserts out here on the humerus and is important in medial rotation, so rotating the arm towards the inside. Here you can see how it looks with those other muscles wrapped around it. You can just barely see it reaching through there. And then your erector spinae, you see it has 3 major portions. For this class, you don't need to know those 3 portions. You just need to know this as the erector spinae muscles. Extends from skull to sacrum, so all the way down your back. And its major action is just to maintain posture and plays a little bit of a role in trunk rotation. And that is it for those back muscles. We will pick up next time with the muscles of the upper arm.